I think I understand our healthcare system pretty well. I'm in practice for 16 years, and through being a resident and also being in private practice and also working with the residents at the hospital, I think I understand it pretty well.
I have a good understanding of the U.S. healthcare system on a macro level, but when you really dive in there and get down to the micro level, things get a little bit more confusing. That said, I'm doing my homework and I'm learning more every day.
Honestly, no. And we all know it's not really a system, it's actually a pretty big market. If we look at the data, we know that about $2.3 trillion in the U.S. is spent every year on health care. But if we look closer at that, we'll see that that doesn't even include some of the real heroes of health care, that is public health, preventive health. And all the good public health professionals will tell you that the thing that matters most in good health care is diet and exercise, and they're very concerned about things like clean water, making sure that kids have a way that they can walk to school and eat healthy foods. Here in New York City, hopefully they can bicycle to school. Is that health care? Well, that really is health care. But about $2.3 trillion a year we spend, more than half of it taking care of people who get sick, many of whom don't have to get sick. So we need to fix that.
So I think it would be great to know what is the amount of money that would take to take care of our whole population, realizing that we have young people who have certain conditions, middle-aged people who have certain conditions, and of course the elderly population, which is growing, is going to have the largest probably medical needs. But that should be a number that we could calculate and give a certain dollar amount to what does it take to basically take care of a person through their life. And I think that number could give us something as a starting point, and hopefully we can try to maximize the value of that amount by giving more attention to preventative medicine.
I have trouble wrapping my head around the incentive structures that exist in healthcare. Unfortunately, sometimes it makes more sense for an organization to act in a certain way, even if it's not in the patient's best interest. And oftentimes, patients ignore short-term lifestyle changes that can save them a lot of money and hardship down the line. As we all know, these incentive structures are about to shift, and that should be really exciting to see.
There's so much I really don't understand. Let's start with what's paid for, how things are paid for. I mean, Mitt Romney in his campaign, he said, if you don't have health insurance, no problem, go to the emergency room and they'll take care of you. And do we really understand how any of that is paid for? Here in New York City, we have 1 million undocumented workers who are really critical to the economy, and when they get sick, we take care of them. That's why we have a large municipal hospital system here in New York, the second largest hospital system in the country, second only to the VA. But we don't understand how any of this is paid for. I don't understand when I look at a hospital bill what's there. It's more complicated than understanding the human genome, and how many people understand how health care is paid for. Our politicians don't understand it. Very few of our citizens understand it. So we really have no idea what health care costs or how it's paid for.
So I think the other point I'd like to understand about healthcare system is how much the insurance companies make from this healthcare dollar. Because what we see as physicians, also small business owners, is that the insurance premiums are going higher and higher, and yet the insurance companies are covering less and less. They're asking for patients to pay more and more higher deductibles and co-pays. So again, where is that money going, and how can we shrink that part of the equation?
I'd like to know more about how technology will affect healthcare and the extent to which certain technologies will be adapted by certain parties in healthcare. I'd like to learn more about the Affordable Care Act and how it's going to affect healthcare down the line. I'd like to know how the FDA is going to approve new technologies like apps and new med devices. And I'd also like to learn about how emerging technologies are going to affect the treatment of disease in humans.
Really, I'd like to understand how we can change our culture and our behavior so that people will stay healthier, so that more of us won't get sick. And I would like to understand how to do that. How do we get people to eat better, to live a healthier lifestyle? When people do get sick, how do we understand how we can keep them as healthy as possible with the most minimum intervention which is necessary for a good quality of life?